Welcome to State of Mind, Being Human and Living Well. I'm the producer and your host, Deborah Sloss, licensed marriage and family therapist, and my pronouns are she, her. In recent years, there's been growing interest alongside growing skepticism about the role that psychedelic drugs can play in treating mental health conditions. Ketamine is an anesthetic drug used to sedate people and animals and is a popular street drug for those seeking a psychedelic high. It's also the subject of an enormous amount of interest as a fast-acting treatment for depression and other serious mental health conditions. Ketamine is a low-cost dissociative drug approved by the Food and Drug Administration as a sedative and analgesic and general anesthetic, which is now being used, mostly off-label, to treat depression and selected other serious mental health conditions. While other psychedelic drugs, including psilocybin, the active ingredient in magic mushrooms, and LSD, as well as MDMA, commonly known as ecstasy, are also being studied to treat various mental health conditions. Esketamine, a ketamine nasal spray, and ketamine are currently the only drugs of this kind that can be prescribed legally outside of clinical trials. Ketamine appears to trigger a cascade of biochemical, structural, and functional changes in the brain and is believed to work by essentially making the brain more malleable and receptive to therapy or alternative ways of thinking. Today, we're going to be talking about a specific kind of treatment called ketamine-assisted therapy, and we hope to clear up some of the confusion people have about how it works and how to access this kind of treatment. Joining us for this conversation is Spencer Wollan, who lives in Salem, Oregon with her wife and 2 cats, but spent most of her life in California. Since her teen years, she struggled with mental health symptoms, trauma, substance abuse, and an eating disorder. After many different treatment centers and hospitalizations, she chose to undergo ketamine-assisted therapy with a doctor in Santa Cruz, California, almost as a last resort. This decision changed her life and her level of functioning for the better. She now hopes to finish law school and be an advocate for those who lack access to the life-changing care and support that everyone deserves. Jesus Ramirez, who goes by Dr. Zeus, is an Ivy League educated and board-certified surgeon who specializes in trauma, severe burns, and critical care. Witnessing extreme human suffering led him to seek a path of deeper service, healing beyond the physical body. He left surgery to obtain a master's in social work and professional training in psychotherapy using both MDMA and ketamine. He now has a private practice therapy in Berkeley where he guides people through healing journeys of self-discovery and supports other therapists by prescribing ketamine for their clients. He views this work as deeply sacred, beyond medicine and therapy. And finally with us is Ellis McCauley, a San Rafael, California-based licensed marriage and family therapist. She's a graduate of the California Institute of Integral Studies and the Center for Psychedelic Therapies and Research. She's also received training in ketamine-assisted psychotherapy through Polaris Insight Center. Ellis specializes in supporting people with challenges related to trauma, as well as clients who are struggling with anxiety or OCD. She's found that ketamine-assisted therapy can expedite and deepen therapeutic benefit beyond what is typical with psychotherapy alone. Ellis hopes to share about how a safe therapeutic collaboration can support the deep healing that ketamine-assisted psychotherapy has to offer. So welcome to State of Mind, Spencer, Ellis, and Dr. Zeus.
Thank you for having us.
Yeah, it's great to be here.
Thank you.
Well, Dr. Zeus, let's begin with you. Can you explain what ketamine-assisted therapy is and tell us a little bit about how it came to be available and how does it work biochemically?
Ketamine-assisted therapy is a mental health treatment that gives people a new experience of self. It combines both medicine and therapy, but it is not really traditional medicine or therapy. It involves a different paradigm than either one of them. It is essential here to distinguish the ways that ketamine can be used because it can be used as a medical treatment. So if you go to a doctor's office, they will listen to your symptoms, come up with a diagnosis, and give you a treatment to reduce those symptoms. But that's not what we're talking about with ketamine-assisted psychotherapy, which I will call CAP. Ketamine-assisted psychotherapy uses ketamine as a catalyst to facilitate the psychotherapy and to facilitate transformation, just like a catalyst in chemistry facilitates a chemical transformation by making it happen more quickly. That's what ketamine does with psychotherapy. Ketamine therapy really started coming into being in the 1950s and 60s when psilocybin, peyote, and LSD came into our culture, and people started investigating it, how it could be used in treatment. Then when these drugs were leaked into the counterculture movement and the war on drugs began, they all became illegal. But ketamine, because it was approved for use as an anesthetic, remained a legally available psychedelic drug. So there were psychiatrists in the 1970s and 80s who continued to use it on the side, notably Salvador Roque in Mexico and John Lilly here in the United States. But it remained an alternative treatment really until the year 2000 when John Crystal's group in Yale started publishing about the rapid antidepressant effects of ketamine. And then it became widely recognized by mainstream medicine and was introduced as a medical treatment. People then began using it in psychotherapy as a legally available drug with psychedelic properties. And that's where we are today. Psilocybin, MDMA, LSD are still not legal, but ketamine is available. And so there are many people starting to use it now in psychedelic psychotherapy. The biochemical effects have been studied mostly in the treatment of depression. And looking at that, it's important to appreciate that depression is neuronal atrophy. That's what leads to depression. And ketamine is something that will reverse that. Treatments that reverse neuronal atrophy result in relief from depression. So whether it be SSRIs or ECT, when you're able to generate neuronal growth, people are able to develop a new perspective on their problems, and that gets them out of that loop of depression.
So how and where is this kind of therapy being offered?
It's being offered throughout the country, and particularly in urban areas and in the West Coast, where psychedelics were traditionally more accepted. So in San Francisco, Los Angeles, Santa Cruz, Denver, Portland, you can find numerous clinics that are providing ketamine-assisted psychotherapy. You can also find it in places like New York City and Salt Lake City. Mostly it's offered in clinics, but it's also offered in the private practices of individual psychotherapists who team up with physicians to prescribe the ketamine for their patients.
And finally, Dr. Zeus, medically speaking, generally, who would be a good fit for this kind of therapy and who might not be a good candidate?
People with treatment-resistant depression are good candidates for this because they've tried other things. It's considered an alternative treatment, right? People in general with depression are likely to benefit, but because it's still considered an alternative treatment, it's probably better for those people to try something else first. And when I speak of depression, I mean bipolar depression as well. There's also good research showing that it can help people with PTSD and with anxiety and with obsessive compulsive disorder. People who would not be a good treatment for are people who are in active mania with bipolar depression, people who have a history of psychosis, people with personality disorders, and people with certain medical conditions that preclude them from receiving the ketamine because of its other effects.
Ellis, from a more psychological perspective, can you talk some about who you found to be the best fit for ketamine-assisted therapy and who might not be such a good fit?
Sure. Yeah. There's really a wide range of who and what kinds of issues can benefit. And I want to say, first of all, that this is also going to be a range of differences between therapists and prescribers as well. But what I look for is that somebody is relatively emotionally and functionally stable, has enough self-awareness to be making this choice and to be also communicating with me and collaborating with me on what they need. And exploring that it's the best option for them. I generally want people to have, a support system that's decent. It doesn't have to be great, but just, some backup, some connection with people for, going out and having support afterwards. And people who have motivation to apply this to their life, because that's really where the healing happens, is when it becomes, the tools become weaved into somebody's life. And also, it's important that somebody's not overly afraid, that they're not pushing themselves into doing this, that it's not too overwhelming, someone that can find kind of a clear yes in themselves. And I would say, as far as who it's beneficial for, I think there are so many different, mental health issues other than the ones that Dr. Zeus just mentioned, of course, that can benefit from the new perspectives that can come. As Dr. Zeus said, the new relationship to self, a different sense of self often not as much vigilance attached to that. Different relationships to thoughts and memories that were previously difficult, and that can be in the case of anxiety or OCD. It can also be in the case of, obviously, trauma and PTSD, or just difficult memories, developmental wounding. It can work really well for people who are feeling really stuck in their life and having trouble getting clarity on how to move forward. I've seen that work really well. Life changes, loss, even end of life are good issues. And I also see it as this, particularly with anxiety, people just being able to learn to let go more, just from being able to go through the process, being a little nervous, doing it anyway, having all the support they need, and being able to learn that really benefits them, so they can then use that tool to apply in their life.
Well, Spencer's also here with us today to share about her experiences receiving ketamine-assisted therapy. Spencer, can you talk some about what was going on with your mental health that led you to look for some kind of new treatment? And what kind of symptoms were you having? And how was your life being impacted by those symptoms?
Yeah, well, I was having a lot of panic and trauma symptoms. Like, I was having flashbacks that felt really inescapable to me, but also something that really led me to look for it is that I had different like treatment options before. Like, I'd done residential treatment and PHP and all of that stuff.
Can you say what PHP is for our listeners?
Yeah, PHP is a partial hospitalization program. So it's similar to like an outpatient program, but it's longer during the day. But yeah, so I had done treatment like that before, and I would go a period of stability, and then I would kind of like just have these recurring lapses into the same symptoms. And that's what led me to look for something that was different, like an alternative treatment.
So, Spencer, could you talk some about like the whole range of kinds of treatment that you had already tried before you looked for this, like medication or psychotherapy? And if so, what were the results of those for you?
Yeah, so I went to about 5 different treatment centers for like inpatient and residential. I had a couple of psychiatric hospitalizations. I did rounds of the outpatient programming, and I did try over about 4 years. I tried over 20 different medications and had consistent psychotherapy for about 8 years. And it's not that I didn't have results with that. I did have some results. I had like these brief bouts following treatment where I was more stable, or medications would make me feel like I was more stable for a bit of time. But I still felt stuck in this trauma. Like, I wasn't able to get out of the responses that I was having. I viewed the world in a specific way, and it felt like it was unchanging. I felt like I couldn't like let go of those ways of thinking. And that's really what led me to look for an alternative treatment again.
So, how did you find ketamine-assisted therapy? And once you did, can you describe a little bit what the mechanics of that looked like?
Yeah, of course. So I actually found the ketamine provider online with my therapist, with my psychotherapist who I had been seeing for about 4 years. And we were looking for different treatments, not specifically for ketamine. We were looking for treatments for treatment-resistant PTSD. And I wasn't, like I said, wasn't looking for ketamine specifically, but saw some really good reviews about a doctor who was sort of in my area, probably like an hour away, but it was totally worth it. And that's how I ended up finding this person. And he actually was similar to what Dr. Zeus said. Actually, he was a doctor and had like a full practice before he decided to go into this. And so when I went in, I initially had to bring in some information from a physical, so that they knew like my heart was okay and my body was, going to be amenable to the process. And then after that, I had like 100+ question quiz weeks before the actual administration, and we went over the results of that. We did 2 full like multi-hour long sessions that explained the science of ketamine and why the doctor was involved and what was important about me being there with my psychotherapist as well. So I actually did it with my therapist, the doctor, and then my partner came to the first 2 sessions. And I did I also want to say that what I did receive was actually intramuscular high dose ketamine infusions. So they were not IV intravenous, infusions. I received it in a little bit of a different way, but I found it to be really helpful.
Can you describe a little bit about what your internal experience was like? Like, how did it feel when you were using the ketamine medicine, and how long did those effects last for?
It's interesting because when I originally did the first few sessions where my doctor explained to me everything that could happen, like in terms of the experience I would have, he explained that a lot of people do experience hallucinations. I didn't experience any hallucinations at all. So it's really interesting to note because everyone reacts really differently to the drug. For me, I actually began the talk therapy portion of it pretty quickly once I was in the once I was actually under the influence of the ketamine. I went kind of like directly into the psychotherapy. And I think part of that is that I had been, I had a history of psychotherapy, so I knew kind of what I was going into. But I found that the bigger effects that I got from the ketamine, actually, I experienced after I had done the doses, like days after.
In preparing to come on the show, you mentioned to me that the results you experienced were different than you had been expecting. Can you talk about that, and what were some of the most surprising aspects?
Yeah, I would love to talk about that. So I actually intended, or not intended, but I thought that I would feel like a euphoria or immediate relief from symptoms that I was having. And I did experience some immediate relief, definitely from anxiety. Like I pretty much after the second full dose I had, I stopped having panic attacks regularly. But I think the continued therapy after is what really kept me experiencing the good effects of the ketamine. Some examples of like what I mean by different results is like I have and had pretty recently after that this like inherent willingness to kind of just use my coping skills. Like it felt easier when I was confronted with the situation and I knew what I was supposed to do, and I felt like, yes, this is what's right for my body, instead of kind of being like, I'm going to shut down, this is my natural reaction. And that's kind of what I mean by like the rewiring. Like things very rarely lead me to panic, because in situations where I previously would have felt really overwhelmed, or like that things weren't going to end, or I didn't know how I was going to get out of the situation, I now have this almost like existential, like big picture feeling of like, okay, I've survived other things. This is going to be okay. I can see and experience flashbacks, but 90% of the time they're like significantly muted. My brain doesn't get caught or stuck like it's a real thing that's happening. Instead, it feels like it was in the past. And those like biological reactions that I used to have are like so much less. And I credit that a lot to ketamine.
Can you also describe how your life's been changed since you received this ketamine-assisted therapy, and have those changes and benefits been long-lasting or short-lived for you?
Feel more confident in going out in the world and choosing to do things that may or may not work. Whereas in the past, I wasn't able to try, or I was able to try other things, but I didn't feel like I was ready, or I didn't feel like I could, even though I was able to. And now I feel like more of this thought of like, what is the harm? I kind of just feel like my neural pathways have been rewired in a way that makes me not feel like I have to do the same thing over and over and over again because it's comfortable. So before ketamine therapy, I could barely hold down a job and I was scraping by to finish that undergrad degree. And now I just finished my first year of law school, and I've worked at the public defender for a couple months, and things are going great.
This is State of Mind, Being Human and Living Well. I'm your host, Deborah Sloss, and today we're discussing ketamine-assisted therapy, what it is, what it's not, and who it may be helpful for. Joining me for this conversation is law student Spencer Wollan, who struggled with mental health symptoms for years until receiving ketamine-assisted psychotherapy, which helped her to undergo dramatic mental health recovery and turn her whole life around. Also with us is medical doctor and social worker Dr. Jesus Ramirez and psychotherapist Ellis McCauley. Listeners of today's show may also want to check out episode 35, titled Healing the Mind and Body with Yoga Therapy, which explores another alternative treatment for mental health conditions. That and many other episodes may be found in our archives at www.stateofmindmedia.org. Now, back to our interview. Well, Ellis, I just want to ask you, when you were listening to Spencer's description of her experiences with ketamine-assisted therapy, what in her experiences seem pretty typical for the clients that you work with, and what strikes you as unique for her situation?
Yeah. So, I think there's a really big range, again, I keep using that word, of different experiences, but it struck me right at the beginning that, it took so long to get to ketamine therapy, and there were so many other things that she tried. And I always feel like my heart goes out to people because our system doesn't always make it easy for people to get the help that they need. So I do see that I definitely see people that have tried everything and kind of come to it as sort of a last resort. I don't think it has to be approached that way. And often my clients come to me when, they're not that desperate and they're just really curious, and it provides a lot of benefit for them. I loved hearing about how you had exactly what you needed, that you had your therapist there, your partner there, and the prescriber administrator, because I think that's how it should be, and that's how it works best, is when people really feel like they are supported in the way that they need to feel safe and to feel like they can be open to the treatment. And yeah, continued therapy. I appreciated that you talked about that, because I think that that's pretty much a consistent, that the people that benefit the most are the people that continue therapy and that practice the tools that they've learned, revisiting the journey in their life, looking at the ways that they see things different. You mentioned seeing everything really differently, and I think that's very common. I do think, some people revert back, and it takes more than just a few, or for some people, it maybe doesn't end up working. So I just want to just say that it's not always something that works for everyone. But yeah, and the big picture feeling, I really like that, because I think the medicine itself and the way we can work with it therapeutically can often really support that kind of wider view.
Can you also talk some about what you see as the important elements of ketamine-assisted therapy and how those are part of the way that you choose to deliver this particular therapy service?
Yeah, for sure. And I guess I want to just start by saying, and I think I'm guessing and imagining Dr. Zeus might feel similarly, that, that there's so much happening right now in the field, and there are many people that are delivering ketamine treatment without therapy. And I have a lot of concerns about that. It can go well and it can go terrible. And there's a lot more really bad things happening psychologically for people. Fear getting, just feeling really, really overwhelmed, and then often souring on the medicine. So for me, it's really important that we have a context of our work together, that my client is oriented to the therapy for a little stretch of time, that they feel safe and comfortable with me, that they feel like they can speak up. I do a whole bunch of preparation work where we actually practice things about the journey, about the session, what that's going to be like, what it's like to speak up, what it's like to negotiate what they need, ask for what they need. During the session itself, it can vary a lot also. Some people go inward a lot. Other people like to process and talk a lot. I think you spoke about that, Spencer, about kind of just talking, and that's okay too. Although it can be helpful to encourage people to do the opposite of whatever they're doing, to just have that experience. I think that the medicine and the journey can be a way of experiencing yourself differently. Dr. Zeus, you said that, and I think there's really something about that. It becomes kind of almost like a peek at a more healed self. And I think that people can remember that afterwards, either probably both consciously and unconsciously, can feel like, oh, I knew I could do that. Like I knew I could face that material. Spencer, you talked about, I could try things new. It was easier. It felt like I could handle it. And I think that that's a common thing. Yeah, and so I think the integration is super important because people get to really look at how these tools can apply to their life, how they can practice them on even a daily basis, of just really remembering things from the journey, remembering tools, trying something different. And sometimes I even find myself doing integration, months down the road, even on a journey that was previous. So yeah, the structure's all really important. And also, we have an agreement that my client is only using this medicine in session. And I think that that's a really big difference than how, some of it is being prescribed where people are using it on their own, which is not necessarily safe, and it's not really likely to be beneficial. It can be, but it's not necessarily, you don't have all your, everything in a row for that to be supported.
So, Dr. Zeus, I want to ask you too, after listening to Spencer's description of her experiences with ketamine-assisted therapy, I wonder if you have more you want our listeners to know about how this therapy can be delivered safely and effectively.
Spencer had a dramatic positive response, illustrating the quantum change that is possible with ketamine-assisted therapy, as opposed to the gradual change that tends to happen with regular therapy, right? That is not unusual. However, as Spencer said, everyone's response is different, and it's important to be aware of that because not everybody can have that dramatic benefit. Many people have a very strong benefit, and the treatment is transformative. Yet it is something that evolves over a person's lifetime, not necessarily some big dramatic response. And the treatment is still effective, right? But people may be disappointed if they're expecting some sudden great change like that. Yeah. Another thing that stands out is that Spencer is young and clearly had a lot of things going on at a young age. And so she would be somebody that would be maybe diagnosed with developmental trauma. And it's been found that those are the people that tend to benefit the most from ketamine-assisted psychotherapy, people who have depression and anxiety related to things that happened in childhood. Yeah. Also, Spencer went through a lot beforehand. She had many treatments. And in my personal experience, the people who are most likely to benefit are those who have gone through a lot of prior treatments. And they have a solid understanding of how their life experiences have affected them. And they want to have a new perspective on their stories. Yeah. I also want to highlight something that Ellis said. Just taking the medicine is not conducive necessarily to healing, right? We're reading about MDMA-assisted psychotherapy can heal people, 70% of people who have PTSD, something for which there is no treatment. However, nobody goes to a rave, takes MDMA, and comes back and says, I got cured of my PTSD, right? You have to do it in the right therapeutic context.
Thank you. And, that leads right into the other question I was going to ask you, which is that I've read that ketamine therapy is a treatment. It's considered a treatment, not a cure. And I'm wondering what your experience that you'd want listeners to know about with related to that.
Yes, if people are going in expecting a cure, they're likely to be disappointed. Again, this is most effective for people who have done a lot of work already, right? Ketamine acts as a catalyst, right? It facilitates transformation. It helps people on their life's journeys. It does not magically change your life's circumstances. And so that's why it's important to note that, Spencer had gone through a lot already and had done a lot of work on herself before she came to ketamine-assisted psychotherapy. She may not have had that much benefit if this was the very first thing that she started with.
Ellis, what do you think is important for listeners to know about ketamine therapy in terms of its role as primarily a treatment versus a cure?
Yeah, I think it's important to manage expectations. I agree with Dr. Zeus 100%. I think that it can have very dramatic results for a certain portion of people, but for a lot of people, it's going to take the effort put in, and sometimes it's going to be challenging. I think that's another aspect, is that people think it's just going to be like, woo, just shoot off to an incredible different life and different being. And sometimes it's going to be challenging. Some people might not even love their first experience, and then they give it some more chance and they're like, I'm starting to kind of understand this and get this and see how it's helpful to me. So I think there's really big range of how it works for people. And thinking that something is a magic bullet and putting all your hope into it can be a setup. It can even change the way that somebody approaches how they are in the journey session, because they're kind of like holding on, like, when's the magic going to happen? When is this going to be all better? And a big aspect of this kind of therapy is that it really teaches letting go. It really teaches people how to trust themselves, how to open up and feel their ability to be with difficult stuff. So I think that's really important too. And if you were just looking for something that's easy and quick, you're not necessarily going to go through that process and that transformation.
Well said.
Dr. Zeus, when I mentioned to some of my colleagues that I was going to do a show on this topic, I was met with skepticism because of the fact that some people have a genetic predisposition for possibly experiencing a psychotic break as a result of psychedelic drug use. It's my understanding that is documented with drugs like cannabis, LSD, and psilocybin or magic mushrooms. So does the use of ketamine carry the same kinds of risks?
It's important to distinguish between the effects of a drug and the biochemical properties of a drug, right? So, for example, sulfa and penicillin both kill bacteria. They can be used as antibiotics, but they have very different chemical structures and different cellular effects, right? So you can develop an allergy to sulfa, you can still take penicillin without any problems, right? So when we talk about a drug being a psychedelic, what we are talking about, with the original definition of the word, is mind revealing, right? Those are the Greek roots for the word, right? These substances can all reveal things about your unconscious, but biochemically, they work very differently. So LSD and psilocybin are clearly associated with the possibility of people developing psychosis that lasts for their entire lifetime. That has never been documented with ketamine, to my knowledge, and ketamine has been around for more than 50 years in clinical use. So you would think that if this were something that would happen with ketamine, that we would know about it by now. There have also been studies of people who are predisposed to developing psychosis because they have a family history of it. And people have looked at whether those people develop psychosis after developing ketamine, and it doesn't really happen, right? So I think it's kind of jumping to conclusions that because it has a psychedelic effect that you could potentially get stuck in that and develop psychosis for the rest of your life. That is not known to happen from any literature or discussion that I've had with other professionals.
Spencer, based on what Dr. Zeus was saying about how using this therapy may not have been as effective for you had you had done it as the first thing you ever did, I'm wondering what role you see it playing now in your overall mental health recovery journey.
Definitely. Well, the first thing is that I'm just motivated to continue on the track that I'm on, by still going to therapy and still using those coping skills and still making sure that I make time, like in my calendar, time for self-care every single week. And I don't think that I would have had that same motivation or that same outlook, like, oh, if I upkeep this, then I'm going to continue to see benefits. And I don't think I would have had that like intrinsic motivation if I hadn't had ketamine. And I think that's, the effects of my treatment, the effects of the medicine are still ongoing because I've chosen to upkeep it. But it's almost like what came first, the chicken or the egg, because I feel like the ketamine therapy is kind of what is kind of what keeps me motivated at the same time.
So are there other important factors that are part of your mental health recovery process today? Like, what do you do to maintain good mental health for yourself?
Yeah, well, one big thing, and I actually say this in job interviews a lot, now that I'm in law school, but like I make sure that whatever's going on in a week, I make sure that there's always a full day where I'm able to carve out time for myself and make sure that I'm not getting overwhelmed. And I think that that's actually something that sets people apart from other people, because so many people don't do that. And it's something that is like a very important factor in upkeeping my mental health now. But also, talking with other people who are in recovery is something that I find to be a really important part of my recovery process, because it keeps me connected with people who have struggled, but that are also like in this area where they're still, choosing to continue living in recovery. And I find that to be really helpful.
I'd just like to say that fits in really well with the recovery model from trauma proposed by Judith Herman out of Harvard, right? She talks about the essential components being establishing safety, telling your story, and then reestablishing a connection with society. So that's where those recovery groups where you can connect with other people are very valuable.
Wow, I had no idea that was like the model. See, it really works. Like,
I also just want to appreciate how it seems like you've just gained a whole different way of relating to yourself and having that awareness of your nervous system, of what's happening, how to regulate. And I think that's something that, different psychedelics, but especially ketamine, can really help with. It has that, it's almost like a form of mindfulness in a way. It slows things down and everything, you can be with yourself in a certain way that you have more understanding of how to regulate in daily life.
Yeah, that's a perfect way of describing how it feels. I do feel like I just relate to myself differently in a way more positive light.
It's great. Wonderful.
So, Ellis, if someone was considering trying ketamine-assisted therapy, where would they start? And what's important for those folks to think about and look for?
Yeah, I think that it's important to, first of all, just really basic, to just be clear that it feels right to explore. You're not being talked into it by somebody else. You're not pushing yourself because you think it's the only, last resort that you have. I think, looking into it, finding out how it works, learning about it, talking to people, definitely talking to therapists or clinics or anywhere that you're going to go, and finding out how they approach the treatment, the structure of it, how it works. I really believe that a big important piece is that the client has a lot of choice in the matter in terms of, how they want to do the pace of it, even weighing in on the dosage. I have a bias towards starting in lower. We call it low and slow. I have a bias towards that, and I think that it increases the, beneficial outcomes. So I think just really making the phone calls and finding out and learning, and then just seeing how that feels.
And can you just maybe for our listeners talk a little bit about what are some of the most common misconceptions you run into or hear about ketamine-assisted therapy?
Yeah. So I think the main ones that I hear are ketamine's a party drug, and you could have a K-hole or you could have a bad trip, or if you start taking it in a therapeutic context, before you know it, you may be addicted to it. And I think that none of these are really very substantiated at all. I know that the substance risk has been coming really low in the research, that there's or low to none almost, that within a therapeutic context, it's very rare that people make that switch over. It's a whole different use of the medicine. The party drug, that's a whole different recreational use. And, that's not really our place to, at least I don't feel like it's my place to comment on that, but it's just, it's apples and oranges. It's completely different. We're talking about a healing modality. It doesn't mean that healing things can't happen sometimes within the other context, but it's so hit or miss and random, and it's a little bit more well, it's definitely, I think, more psychologically risky. As far as like the K-hole or the bad trip, I mean, first of all, the K-hole, the reason people think that that's terrible is because they're using it to feel good, and they're getting kind of pushed into an expansive, powerful experience that they weren't really wanting to do at their party, for instance. So I think when we talk about a bad trip in the world of psychedelic medicine, we tend to find, and this is, I think, substantiated by the research, that it's not necessarily a bad outcome, that something that's unpleasant can be, if it's well supported, if the person feels safe, if they made the decision in a way that all lines up with their values and what they want, that it can actually be very beneficial and very expansive for people.
This is State of Mind, Being Human and Living Well. I'm your host, Deborah Sloss, and today we're discussing ketamine-assisted therapy and learning more about this medication and the role it plays in these newer approaches to treating some mental illness conditions. Joining me for this conversation is law student Spencer Wollan, who has experienced what she calls life-changing benefit from ketamine-assisted therapy. Also with us is medical doctor, social worker, and ketamine prescriber, Dr. Jesus Ramirez, and psychotherapist Ellis McCauley. Every State of Mind episode has a resource list, and the resources we talk about today and more can be found in the show notes for this episode. You can also listen or subscribe to our podcast on all the major podcasting platforms and on your home smart speaker. Show notes, resources, our podcasts, and where to subscribe to them can all be found at www.stateofmindmedia.org. Back to our interview. Spencer, I want to come back to you as we were talking about misconceptions. I also want to ask about if you experienced any specific stigma associated with, pursuing this kind of therapy, or any barriers to accessing ketamine-assisted therapy.
Yeah, well, when you speak about barriers, I think the first thing that comes to mind and is going to be pretty much a barrier a lot of people are facing is just the cost. I don't know what it's like now. I also did this, about 2 or 3 years ago, but I was able to pay for it. It's definitely doable. And I regular salary. It's not like I have, a lot of money to spend on stuff like this, but it was doable. But it is a barrier that people face. And so I think if you're thinking about doing it, just knowing that that's something you're going to have to do. Something else is, with the stigma aspect of it, I did feel worried to tell people. I think at first I didn't have a stigma about it in my own head, just because also I didn't really hear about ketamine that much. One time I got my tonsils out and they did give me some ketamine, but I have no experience of it because I was sedated. And so I didn't have any thoughts about it. I didn't even know it as a party drug. But as I said kind of in the earlier part of the interview, I did have substance abuse issues. And I had no problems with ketamine in terms of using it outside of therapy. I even actually had a small dose, sort of like a booster dose that I could do at home. And I used it one time and never outside of that. And I didn't feel a need to. And so I think that is a stigma that people have. And I think that's why I do feel worried sometimes to tell people, is that they may have this idea about it that's just not true. Mm-hmm. But yeah, I would say that besides the barrier that is possible to overcome of being able to save up and pay for something, that's really important. There weren't other barriers of accessing it. And for me, because of where I lived, but I can also, as Dr. Zeus said, where it's most popular, I can imagine that people who live in certain geographical areas just have a lot harder of a time accessing it.
Dr. Zeus, can we talk some about the accessibility of this kind of treatment? Is ketamine-assisted therapy covered by insurance? And if not, what kinds of costs are involved for both the medicine and the treatment?
That is a big issue. Ketamine-assisted psychotherapy is labor-intensive, and therefore it's expensive and not readily accessible to everyone. Yeah. Psychotherapy itself is expensive, but now you're talking about doing 3-hour therapy sessions with a therapist and then a follow-up integration session 1 or 2 days later. So now you're talking about 4 hours of therapy, right? That is expensive. Plus, the people that are practicing this tend to be people who are on the higher end in terms of expenses, and not a lot of people are doing it. Not very many insurance companies cover this. The vast majority of them don't. Some of them do. Dr. Bronner's, the soap manufacturer, he provides ketamine-assisted psychotherapy for all of his employees if they want it, right? The VA medical system also offers ketamine therapy, although that's not psychotherapy. That I believe that's actually more along the medical model. But so it is possible to obtain it, but the vast majority of insurance providers aren't going to cover it. And you're lucky if they provide some of the therapy. Right. So if you're looking at the costs in the Bay Area, a ketamine session for 3 hours with a therapist is going to cost you around $1,000 plus $200 for the integration session, right? One cycle of medicine and integration isn't enough. Typically 3-4 cycles are required, maybe 6. So now we're talking about a treatment that's going to cost about $4,000 to $6,000 once you start throwing in all the therapy and the medical evaluation. The ketamine itself is not very expensive. You can get that for about $100 for a full course of treatment. But it's the therapy part, and that's what's really challenging. Mm-hmm. People are working on making this more accessible. There's a place in Oakland called Alchemy that uses associates to provide the therapy, and they try to offer low cost. There's also ways of obtaining it online through online companies, but they tend to compromise with the therapy. They're not using licensed therapists. They tend to use guides who are unlicensed, and you don't know what quality you're getting there. And from what I've heard from people who have gone through this, the quality is just not that great. And so that really affects the benefit that you're going to get from the therapy.
This seems like a good time to talk about resources, as Dr. Zeus mentions, one of the lower cost options. I'm wondering if there's one or two resources, Ellis, that you'd want to call out for people who want to learn more about ketamine-assisted therapy.
Yeah, sure. I want to also just support what Dr. Zeus said about alchemy therapy. I was the supervisor there for a while and really appreciate their work, and they definitely work to make it accessible to people. I think on the resource list, I gave an article that's pretty lengthy, but has a lot of research and a lot of just a great overview of the potential for healing of ketamine, as well as KRIA Institute. It's a research institute that's a hub for clinicians and clients, and it's got a wealth of information.
So Spencer, what about you? Are there resources that you'd also want to share that have been helpful to you as you either were receiving the ketamine-assisted therapy or after?
Yeah, definitely. So, the first one that comes to mind is Shine a Light Counseling Center in Santa Cruz and Watsonville. They offer low-cost sessions for people who are uninsured, and they pretty much saved my life when I couldn't use my insurance for the amount of sessions I needed. And they have really great counselors who are under a really awesome supervisor, and they do they don't just do individuals, they also see like family and couples and children. So that's a really great resource. That's a center I went to for years in Santa Cruz, and I couldn't recommend it enough. The second thing that I would just recommend is TWLOHA, To Write Love on Her Arms. That's a organization that's been around for a really long time, offering mental health resources. And they have a scholarship for treatment that I've known multiple people who have been offered that scholarship, and it's offered to those who can't afford life-saving mental health treatment. And they go through a different cycle every year and grant scholarships to people who otherwise wouldn't be able to afford treatment. So I recommend that resource. I highly recommend that resource.
Oh, that's fantastic. Dr. Zeus, what last few things would you want to leave our listeners with? Information about ketamine-assisted therapy or last thoughts?
I would say the most important thing is to go out and do your research. And as you're doing your research, there's two things that you really need to look at closely. First of all, the different ways that ketamine is used in treatment, right? There's the medical model of symptom reduction, and there's the therapy model of self-discovery and transformation. Which one is it that you want? Which one are you looking for, right? And then once you've researched those two different models, take a look at the providers that are out there and look at their credentials and see what kind of treatment they're going to be offering you. Yeah, this work isn't very tightly regulated yet. And so there's people out there doing this work, taking advantage of the hype to make a profit. And some people are better qualified than others. Yeah. The physician that Spencer saw, he was not licensed to provide psychotherapy, but he went out and did a lot of work in behavioral health and studying Buddhism and studying cognitive behavior therapy so that he could bring this work together and provide ketamine-assisted psychotherapy, not just medicine. There's plenty of other doctors out there that are just giving you ketamine, sitting you in a corner, and not really giving you the supportive care that you want, thinking that, I gave ketamine to somebody in the hospital when I was giving them anesthesia. I can just give ketamine to people in a clinic and it'll work the same. Well, it doesn't quite work that way. You wouldn't want a psychiatrist doing your appendectomy, right? Or an ear, nose, and throat specialist doing your colonoscopy, right? You want somebody who really knows mental health and is approaching this in a healthy way. The same applies if you're going to be doing online work because you want to cut corners and save some money and get ketamine delivered to your home with an unlicensed guide. I wouldn't vouch for the quality of some of that based on what I've heard. Yeah. Therapy is expensive. Ketamine-assisted psychotherapy is an intensive treatment that requires a major investment of time and money. Yeah. Properly curated, the work is deeply sacred. It can transform the way that you understand your life circumstances, yourself, and your connection to something bigger.
Spencer, what last few things would you want to leave our listeners with? These may be things that you wish you had understood maybe earlier in your own mental health recovery process, or perhaps something that you've learned along the way.
Yeah, I think something I heard that I heard before, well before I actually really thought about it and understood it, is just the fact that you keep searching for help, the fact that you seek out ways to alleviate your symptoms. And that means you have this incredibly strong, it could be unconscious will to survive. There's something inside you that knows that you can and will like see recovery. And if you feel like you're at a rock bottom, but you're listening to mental health podcasts and you're going to therapy or looking to start, or you're taking your medication or you're getting up out of bed, like those are the things that show how much you're doing for yourself and that you're actively trying to be on the way to recovery, even if you're having all of these symptoms. And that work is going to pay off in some way, somehow.
Ellis, do you have any last thoughts that you'd like to leave our listeners with today?
Yeah, just to trust yourself. If you feel interested in this modality, to look into it, to feel into what, who and what might feel right to you as far as proceeding. And I think this is just a really exciting time, our human family really needs support in this time. That sounds like a hokey way of saying it, but we're just in a rough time in history, I think, on so many levels. And I think that psychedelic medicines can provide support and big changes. So I think it's exciting, really important to do in a safe and supportive way.
Well, that concludes the interview portion of our program. We'll now hear from Jocelyn, who has struggled with mental health symptoms for years. She shares how she experienced symptom relief through her use of the ketamine medicine, as well as longer lasting and deeper healing from trauma from the ketamine-assisted psychotherapy she received. I want to note that the self-administration of ketamine outside of a controlled therapeutic setting is not recommended by any of the professionals I spoke with for this show. Here's Jocelyn.
Hi, my name is Jocelyn, and I have PTSD and PTSD-induced anxiety, depression, and dissociative disorder. I started microdosing ketamine over a year ago after a traumatic event that left me with a lot of pain. And so I started the ketamine to manage pain, but I found it gave me a lot more. As a person that experienced a lot of trauma in my childhood, I was suffering from 3 to 5 panic attacks a day. I couldn't sleep. I felt constantly hypervigilant and terrified in my body, always fearing something horrible was about to happen to me. And after starting to microdose on ketamine, I discovered not only what the feeling of safety felt like. Ketamine really helped me to melt into, the couch that I would sit on when I was taking it. And the beauty is that it taught me how to access that state of calm and peace inside myself without needing to take the ketamine. I decided to do 3 ketamine-assisted journeys with a doctor and a therapist to see what else ketamine might offer me, because it had such a profound impact after microdosing. And I needed a lot of support from friends and the doctor and the therapist. Ketamine is a dissociative, and as a person that struggles with a dissociative disorder, it definitely had a pretty big impact on me. But with a lot of support from others, I was able to experience a lot of epiphanies and just had a lot more insight into my trauma and the experience of myself and my journey. And I think ketamine has been just a remarkable substance that has significantly helped me in my journey. I do not think ketamine alone is the answer. I think healing requires, it's kind of like a mosaic of all different parts that come together to kind of create this beautiful whole. But nothing alone has been the one answer. I think trying many different things is kind of important. But ketamine has been a really crucial, helpful tool for me in my healing journey. And I hope that this information can help others as well.
In closing, I want to share a quote from a Washington Post article that's included on our resource list called Ketamine for Depression, What It Feels Like and Who It Can Help. In that article, Gerard Sanacora, a professor of psychiatry at the Yale School of Medicine, was quoted as saying that while ketamine can be life-saving for some patients, many questions remain about the range of disorders it might help, the best mode of delivery, optimal dosing, and long-term safety. It is not a miracle treatment for everyone. With that being said, I want to say a huge thank you again to our guests today, Spencer Wollan, Ellis McCauley, and Dr. Jesus Ramirez, and to our In Your Voice contributor, Jocelyn. And thanks to you for joining us here on State of Mind, Being Human and Living Well. I also want to encourage you to check out the wealth of information included on the resource list in the show notes for this episode. New episodes of State of Mind, exploring mental health and wellness, are released the first Sunday of every month and can be found along with our complete archive on our website, www.stateofmindmedia.org. If you missed part of this episode or you just want to hear it again, subscribe to our podcast on all the major podcast platforms. Also, when you rate and review our podcast, you do help it get found and heard by more listeners. So if you like this or any of the episodes, could you please do that for us? Special thanks to Jeannie Baldzikowski for audio production and to Patrice Vecchione for In Your Voice story coaching. And thanks to acoustic guitarist Adrian Legg for composing, performing, and donating the use of our theme music. State of Mind was developed and originally broadcast in association with KSQD-FM in Santa Cruz, California. Come on back and join us again next month for a whole new episode of State of Mind. Until then, live well.